Hi. Welcome back to Mindflux. Anyone who has ever had the experience of watching someone they love suffer through an epileptic seizure knows how frightening it can be. Epilepsy is a neurological condition that causes seizures, but most types are completely controllable with medication. There are many different types of epilepsy, and everyone responds differently to treatment. In this video, we will discuss common forms of epilepsy as well as what you can do about them. Let's jump in. A seizure is a burst of electrical activity in the brain that causes a disruption in normal body function. The frequency, severity, and type of seizures will vary depending on the person's health condition. These seizures can be classified as either partial or generalized and occur when abnormal electrical activity causes sudden changes in behavior, sensation, consciousness, and motor functions. The causes of epilepsy are still unknown. Epilepsy is usually diagnosed after a person has had at least 2 seizures and an EEG. There may be a genetic component to the disorder, as it tends to run in families. Certain brain disorders can also cause epilepsy, such as tumors or strokes. Here are 2 types of epilepsy. Number 1. Focal onset. This type of epilepsy typically begins before the age of 20 and results from an abnormal section of neurons somewhere within one hemisphere, half of the brain. Number 2. Generalized tonic-clonic. This type of epilepsy, also known as grand mal or tonic-clonic. It is the most common among adults. It begins in childhood and can last for years, decades, or even a lifetime. Grand mal seizures may be preceded by an aura that lasts between 5 minutes and 15 minutes. The aura may consist of an odd smell, a strange feeling in the stomach, or visual disturbances such as flashing lights. During the seizure itself, victims will usually lose consciousness and begin to convulse violently before eventually becoming unresponsive for several minutes afterward. The 3 common types of seizures are: Number 1. Focal onset seizures. These seizures can be either simple or complex, depending on how much they affect their victims. Simple focal onset seizures are usually experienced as a brief absence. During this absence, people will often stare blankly into space for several seconds before returning to normal activity. Number 2. Complex focal seizures. These seizures can be far more severe and debilitating, with some victims experiencing muscle spasms or full-body convulsions. Number 3. Atonic seizure. This type of seizure occurs when the brain's neurons fire off too many signals at once. As a result, the victim will suddenly lose consciousness and collapse to the ground. Atonic seizures are sometimes called drop seizures. Epilepsy should not be taken lightly. The seizures associated with this condition can cause serious physical harm, and victims should seek medical attention immediately if they experience any symptoms of a seizure. In fact, many people who do not have epilepsy also suffer from seizures triggered by mental conditions such as depression or stress. These seizures are known as psychogenic non-epileptic seizures. Psychogenic non-epileptic seizures can be just as dangerous and should also be monitored by a medical professional for effective treatment. If you or someone close to you is experiencing these symptoms, it's important that they seek medical attention immediately. If your loved one has been diagnosed with epilepsy, it's imperative that they understand what form of the condition they are dealing with in order to get the right medication for their specific condition. The 3 main treatments for epilepsy are: Number 1. Convulsive therapy. Number 2. Anticonvulsant drugs. Number 3. Surgery to remove the part of the brain where seizures are occurring. That's it for today. Hope you enjoyed this video. Don't forget to like and share this video and subscribe to our channel. Thank you for Mindflux.